Hello dear students, welcome back to my channel. I love pharmacology. So in this session, let us learn about a very important topic that can be asked in your Viva OC frequently. That is, which are the drugs which gets deposited in the tissues. So there are some drugs which gets deposited in the tissues and they get stored in the respective tissues, and later on, due to the increase in concentration of a particular drug in the tissue, it can lead to toxicity. So let us analyze how this tissue storage will occur and what are the consequences of it. So here you can see that when a drug is administered, it gets accumulated. So few of the drugs gets accumulated inside the specific organs. How? It gets accumulated through an active transport or by binding to a specific tissue constituents, and thereby it gets stored inside the specific organs. So once it gets stored in the specific organs, please remember such drugs will have unequal distribution. So there will be an unequal distribution of the drug concentration, as well as there will be larger volume of distribution. So whichever the drugs which gets accumulated into the specific organs will have a unequal distribution and a larger volume of distribution, and altogether it will contribute to longer duration of action. So please remember, since there is a larger volume of distribution, because of the higher concentration of the drug which stays inside the specific organ can lead to some local toxicity. So moving on to the examples of drugs which can get stored in particular tissues are. So here you can see that. So here you can remember 6 examples like tetracycline, chloroquine, streptomycin, digoxin or amitin, iodine, and the thiopenton. So let us see where does this drugs gets accumulated. So tetracycline will gets accumulated inside the bone as well as in the teeth. So thereby it can cause deformation of the bone as well as discoloration of the teeth. Whereas in case of the chloroquine, they gets accumulated inside the retina, they can cause retinal damage. Apart from that, chloroquine can also get accumulated inside the liver as well as kidney, and at higher concentration it can lead to hepatotoxicity as well as renal toxicity. So the third drug here is streptomycin. So this streptomycin can get accumulated inside the ear, especially in the vestibular apparatus, and it can cause hearing impairment. So next, moving on to the digoxin or amitin. So digoxin as well as amitin can get deposited inside the heart, skeletal muscles as well as in the kidney. So increase in their concentration can lead to abnormality in the cardiac activity as well as in case of skeletal muscle and the renal function. So next, moving on to the fifth example, that is iodine. So the iodine which are mainly used for treating hypothyroidism can get accumulated in the thyroid. So apart from that, the one more example is thiopenton. Please remember, thiopenton gets accumulated in the adipose tissue. So they get dissolved in neutral fat due to high lipid solubility. Due to the high lipid solubility, they get dissolved in the neutral fat, that is in the adipose tissue. So just to recapitulate about the examples for tissue storage, you have tetracycline, chloroquine, streptomycin, digoxin, emetin, iodine, and thiopental. So along with that, you need to remember where these drugs gets accumulated. Tetracycline gets accumulated in the bone and teeth. Chloroquine gets accumulated mainly in the retina, liver, and the kidney. Streptomycin gets deposited mainly in the ear, that is in the vestibular apparatus. Digoxin as well as emetin gets deposited in the heart, skeletal muscle, kidney. Iodine gets deposited in the thyroid. Thiopental gets deposited in the adipose tissue. Apart from that, a very important point you need to remember is tetracycline will get accumulated inside the specific intracellular organelles like mitochondria. Please remember, tetracycline can get accumulated inside by selectively binding to specific intracellular organelle, that is mitochondria. Similarly, the chloroquine can also selectively bind to specific intracellular organelle, that is nuclei. So this was about the class on drugs and its tissue storage. If you find this video useful, please do subscribe to my channel, I Love Pharmacology, and do not forget to share and hit the like button for more updates on pharmacology. Thank you.